Welcome to Hospice Explained. This podcast is intended as an educational aid and is only a resource to begin to understand the end-of-life season. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Please always seek advice from your physician or qualified members of your healthcare team with any questions regarding a medical condition.
Hello and welcome to Hospice Explained. This is episode number 128. I'm your host, Marie Betcher, RN. Thank you for listening. I am going to just talk for a few minutes, and this one is about fall prevention. To start with, I mentioned it, I think, on my last episode that I did have a fall, and it's just a great reminder that as people age, as situations change, that we need to be careful, we need to be thoughtful, and I can tell you my specific example was two things, and I was in a hurry, quite a bit of a hurry, and I had brand new shoes, and the shoes stuck, and I didn't, and I kept moving. And that has been, it's quite a reminder to slow down, and just a great time to remind myself also about safety for prevention of falls for your loved ones. And there's a lot of reasons. It's not just a couple reasons somebody might fall. There are so many reasons. They could have eyesight changes. It could be medications that are causing it. The blood pressure medicine, they're sitting up, standing up, and their blood pressure drops. Balance, gait issues, how they walk, in other words. The lighting, as winter approaches, and we're in the winter season in the Pacific Northwest, and it gets dark pretty early. Poor lighting can be a problem. And I thought about, we often change our house and the layouts for holiday decorations. Decorations could be in the way. They could, somebody who's used to walking in a certain pattern didn't walk around, for example, the little Santa in the walkway. So things to think about. If somebody has a chronic condition and they're just getting worse, we need to have their environment clear or to think about prevention of falls. Balance issues, floors that are slippery, ice can be a problem, rain, wet, all sorts of leaves. Leaves get slippery too when there's so many of them. So if somebody's also in unfamiliar surroundings, if the pavement's broken, foot problems are a big deal. If they're not wearing good shoes, I personally had brand new shoes, only wore them the second day I had worn them. And I had them stick in other spots, but when I had that combination with really trying to go fast, it just didn't work. So things to think about. Distraction, for me, I was in a hurry. That was a great example. Lots and lots of reasons why there could be a fall. Other things that you don't always think about, oxygen tubing. So if somebody's on oxygen and they're walking through their house, tubing could be all over the place. So you have to be very careful that somebody else doesn't fall because of their oxygen tubing. Often the person is paying attention when they're wearing oxygen. But what if somebody else comes in? And pets. Pets can get in the way. Pets don't mean to, absolutely don't mean to, but sometimes they do. And injuries happen with falls sometimes, not every time, but injuries can happen. And, serious major injuries can happen. So we need to be very thoughtful of that. Just remember that the elderly are at higher risk for falls. Something we don't always like to talk about, pride. Pride can be a big issue. As I talk to patients, I ask, do you use a walker or wheelchair or, a cane or something? And a lot of folks tell me they couch surf, or furniture surf, meaning they grab one piece of furniture, then they grab a wall, then they grab the door, and they just kind of keep grabbing things. Well, and this time of year, the holidays, and I realize that different times of the year can have different decorations and different things happen, but that's just not the safest plan. And sometimes that's a pride issue that people don't want to admit that they need help. And so if that's you I'm speaking to or your loved one, try to address it in a kind way that maybe they need to think about using a walker or at least using something for balance, sitting up slowly, things like that. And then using a wheelchair maybe only when you're out of the house and using a walker in the house. Make a plan, talk about it, have it be a conversation and don't have it be a harsh conversation. If you can approach this conversation with your loved one and just say, hey, have you thought about falls? Have you considered how recovering from these falls can be? Ask questions in a way that promote conversation. So what about to remove trip hazards? Sometimes it's those carpets that have rolled up, just simple things, making sure you put things away, move them out of the walkways, have clear, open walkways. Have your loved one wear a good, sturdy shoe. When they get up in the morning, put a good pair of shoes on that are fitted, maybe shoes that tie on versus just slip on, something that doesn't cause more problems. If you suspect medications are a problem, your loved one's situation has changed, maybe their needs for medications have changed, always consult your provider. Go over the medications and make sure that your loved one is on the correct dose of medications. If there are a lot of balance issues, again, talk to your provider. Maybe it is still medication related, maybe it's strength related. Exercise is really important as everyone ages, and it's really important to do regular exercise, walking. Weights really help for good core strength so that if you do get off balance, you have a good core. Physical therapy can be utilized to improve. Ask your provider to refer your loved one to physical therapy. Say, I have concerns that mom's strength is decreasing and I just want to prevent falls, and physical therapy can help. They can also watch your loved one walk and they can give some advice. Make sure that if somebody isn't wearing their hearing aids, that they know that the pets are young kids, or make sure they're aware of their surroundings. Lots of just general ideas, things to think about with falls. So to wrap this up, fall prevention, make it a priority. Try to do some exercises to improve strength and improve balance. Make sure you've reviewed medications, reduce trip hazards in the home, have clear open walking spaces, and if needed, using walkers, wheelchairs as needed in the home, and absolutely have good shoes. If your loved one has signs that they're falling for no reason and you have concerns, I just encourage you to reach out to your provider if your loved one is falling and have this be a discussion with your loved one, yourself, and your provider to make good decisions for their needs and their treatments. And also remember that when patients are on hospice, sometimes they get up because they get confused or they think their body is still strong and they try to stand and their legs don't even hold them up. If you need it, you can call for what we call a mercy lift from the fire department. Just remember to have the POLST form or whatever your state calls it. It's the physician order for life-sustaining treatment. That form says that the fire department doesn't have to take your loved one to the hospital. That's an important form if they don't want to go back to the hospital and they're on hospice. And you, for example, don't have the strength to pick your loved one up back and put them back to bed. Safety. Lots of things to think about with safety. I appreciate you, audience. Take care. Thanks for listening to Hospice Explained.
Thank you for joining me on Hospice Explained. Think about ways you can make a difference in someone's life. Also, please subscribe and share this podcast with anyone who would benefit from listening. Thank you.